I think maybe we'll make a start and hopefully some people will join as we go along. So I will just to introduce to everyone, my name's Teresa Earle. I'm one of the GP cancer leads supporting East Birmingham, and here today to introduce, I think we have introduced to GPs in East Birmingham briefly about this pilot that's going to be starting in August, but we wanted to give a more detailed update with the information of exactly how it's going to run. So I'm going to share my slides and crack on, and then please, if anyone has any questions, feel free to put them in the chat, or at the end, I'm very happy for people to unmute and ask questions as well. Okay. Can anyone see my slides?
Yeah, can see them.
Yeah, perfect. Okay, right, we'll make a start. So in terms of this presentation, so we will make it available to GPs in East Birmingham, and it has all the key different documents and leaflets and things that will be used in this service. So this is just a kind of notification of the different documents that we'll be providing. Just to give a bit of background, so this is a service that runs in other parts of the country, Manchester and Leeds, as business as usual, and has already been running for quite some time. The idea behind it is that an individual can hear about the service, decide they meet the criteria, and then self-present for a chest X-ray without the need to see their GP first to get a referral. It's being done as a kind of health inequalities project to help try and reduce barriers to getting chest X-rays and promoting early diagnosis of lung cancer. We're starting this in East Locality with the hope that after kind of 6 to 9 months, we'll be able to evaluate, and if things are going well, then roll it out across BSol. And it will be a walk-in service that will run from Washwood Heath CDC. This just for your information, there's a lot of different people involved who've been helping to set up the project. I'm sure those of you in East Birmingham will know about Washwood Heath, the Community Diagnostic Centre. At the moment for this pilot, it will only be available in Washwood Heath, not the other 2 CDCs. And although the service at Washwood Heath is 7 days a week, 12 hours, we'll be offering this service initially Monday to Friday, 8 to 6, and Saturday, 9 to 1. In terms of eligibility criteria, so there's 4 criteria that the patient would need to meet: being equal to or above 40 years old, have a registration with a BSol GP practice. They can't have had any chest imaging, either chest X-ray or CT, within the prior 3 months. And they need to meet one of the NG12 criteria for lung cancer as outlined in NICE. So have 3 or more weeks of duration of one of the symptoms. And here are the symptoms that will be advertised on the poster for people. So if they've had any of these for 3 or more weeks, they can present for a chest X-ray. Just this will be more for everyone's information if you need to refer to it at any point, but just to give you an overview of the process. So the patient may hear either through, we're working with some community organisations, so they may see a poster out and about, or through a pharmacist, we're going to work with pharmacies, or they may actually contact the surgery, and at the point of contact when the triage happens, if either a receptionist or anyone triaging calls hears that they meet any of the symptoms, they can also direct the patient to the Washwood Heath. The patient on arrival will complete a specific referral form. The administrator there will check that the patient's registered at a BSol GP and confirm the practice. The radiographer will then check that the patient meets the eligibility criteria and that they haven't had a scan in the 3 months prior of their chest. The chest X-ray will then be done. and we'll go through the normal reporting routes as any GP requested chest X-ray would. The patient is given a written information leaflet, safety netting, and asking them to contact their GP 7 to 14 days after to discuss the result. The administrator at the CDC will then email the patient's GP a template email to notify them of the patient's attendance for a self-refer chest X-ray. And we're then suggesting that practices make a note of this on the patient record somehow. There isn't a specific like SNOMED code, but we're suggesting that practice put an entry on the notes just for the purpose of if the patient tries to contact the surgery before 1 to 2 weeks, it may be confusing for staff if there's no record of them having had a chest X-ray. So that's the reason for that. And then the chest X-ray report will arrive through the ICE inbox and then should be allocated to a GP to action. And then we are encouraging that contact should then be made with the patient, either by text, by call, or a face-to-face review, depending on what the patient presented with. But in theory, a patient could have had fatigue or a neck lump and had a chest X-ray. So it's really important to ensure that there is a follow-up process in place if the chest X-ray is done and nothing is detected. This is a example for you of what our poster looks like, which will be going up, and we've managed to put a QR code on now so they can access it digitally also. This will be the registration form that the patient will get when they arrive at Washwood Heath. And so they'll have to just tick the boxes to show they're eligible, provide all their information, GP details, and what symptom they have or symptoms. This is the leaflet that will be given to the patient after they have their chest X-ray, just advising them about contacting the GP in 1 to 2 weeks, advising them about the NHS app that they can also look there for the result. And also advising them very clearly that if they have any ongoing symptoms, even if the chest X-ray is normal, that they should make contact with the GP for a review. This is the template we've got for the email that will be sent to the GP practice, just letting them know which patient it is that's attended and that they've attended for a self-request chest X-ray. So as I have already mentioned, on receiving the email notification, we would encourage practices to make some kind of note on the patient record. So any staff who are looking to see would know that they've attended for the X-ray and that we're waiting for a report. And then in terms of when the report does come back into ICE, we are just reminding surgeries about having some kind of system for checking the ICE inbox and allocating reports to a GP for review. And then it'll be very kind of individual to different practices as to how they choose to action that, whether it's with a text, a call, or a face-to-face appointment. Just for GPs, I've put a screenshot here from ICE. So we did it with a kind of dummy patient to check that everything worked, and the report came through on ICE. And so this is what it will look like, just to kind of reassure GPs in terms of, so it's very clearly, with clinical indication, it very clearly says which criteria the patient has presented, which symptoms they've presented with from the NICE criteria. And then in the findings section, it starts by specifying that this is a self-request chest X-ray and what the patient had to meet to present for that. And then it also gives the report of the chest X-ray below. And if there was a suspicion of a lung cancer picked up, it would then specify that the patient has been referred on the DXCT pathway. In terms of outcomes from the report, so if it is a suspected lung cancer, this will automatically be directed internally at the secondary care onto the DXCT pathway, and the GP will be notified of this. If there's other lung pathology, we would ask that, as with any GP requested chest X-ray, that's just followed up as a GP would normally. And then if it's a normal chest X-ray, at this point, because the patient hasn't seen a GP before the chest X-ray, we are advising that some contact should be made with the patient to try and follow up other symptoms, if it wasn't a cough, for example, if it was fatigue, but in general, to make sure that there's some safety net there to follow up with patients. We've suggested a template for a text message that could be sent to patients with a normal chest X-ray, asking them to make contact with the surgery if they have any ongoing symptoms. This is just for your information. It's quite a lot of information, but it's our SOP for this pilot. Just a few points about learning from the services that already run. So in Leeds, it actually started in 2011, and they had 10 years where the service was running before COVID hit, and they looked at that 10 years of data in quite a lot of detail. So in that period, the service was accessed 12,000 times. 67% of users were current or ex-smokers. About 35% of users were from the lowest quintile of deprivation. The volume of X-rays stayed consistent at about 3% increase in volume of all GP requested chest X-rays. So Leeds, for example, told us that for a year for the whole of Leeds, that would equate to about 1,000 to 2,000 chest X-rays. So it is small numbers compared to GP requested chest X-rays. From their data, about 4% of patients had a chest X-ray suggestive of a potential cancer, and they had evidence to show that increasing usage of this chest X-ray service was associated with a reduction in emergency presentations of lung cancer and the proportion of advanced cancers during that period that were detected of lung cancer. Manchester is the other place which has been running for a few years now. The average age of their users was 66, about 51%, so a bit less were smokers or ex-smokers, but the highest proportion of users were living in areas of greatest social deprivation. They had about 15,000, no, sorry, that shouldn't say, that should say 1,500, that's an error, sorry, chest X-rays in the initial 9-month period, and about 33% had not seen their GP before they went for the chest X-ray. And about 15% said that they wouldn't have seen the GP if the service wasn't available. They would have kind of just not done anything about their symptoms. So that's just a bit of background. In terms of next steps for practices, we're hoping that you'd be able to share information within your own practices with staff. I think it is a project that will be really useful for all staff to know about, including front of house, reception staff, also obviously medical secretaries with regards to receiving reports, and GPs and practice nurses also. The poster that is included in the presentation, we would be really grateful if that could be put up in the surgeries and on your website. And if possible, to send a text to patients informing them that the service is starting. So the launch date is the 3rd of August. It says it clearly on the poster. So if it was possible to send a text around that time, we think that would be good for raising awareness about the service. Within practices, we think it's important that there's just a discussion about how the system works in your practice and how you'll monitor for chest X-ray reports that come in. In terms of any concerns or queries during this pilot, my details are included at the end of this presentation, and I would be your port of contact if you have any concerns or you need to raise anything about the pilot. And then once the pilot starts in August, they know in Leeds it's been very popular actually with GPs and practices that actually they're signposting patients to the service both before seeing a GP. So if a patient calls up or presents at the desk and they have symptoms, they can be directed there, but also some GPs who are actually seeing patients are sending them just direct for an X-ray that day, as opposed to them requesting one. In terms of, I've included the contact details at Washwood Heath for if there was a query regarding an X-ray, if a patient said they'd had one and you didn't receive a report or there was some issue, these are the contact numbers to call for that. And then my details are here in terms of please do contact myself with any issues, queries, concerns about the pilot. And I'm going to stop sharing now and would ask if anyone has any questions at all. Please do. I'm not sure about the chat bot. box if there's anything in there, but please do raise your hand or unmute yourself if you want to ask any questions at all. Like I said, we will be putting, we'll be sending out these slides to everyone who attended, and hopefully that's got the information that you'll need regarding the pilot.
And would you please send us this printout of anything, we can put it on our reception or, in the room so that the patient can use the QR code? With the
Sorry.
poster item.
Was that for posters?
Yes.
Yeah. Okay. So you'd like us to actually send out kind of the hard copy posters?
Yes, please, if you don't mind.
Yeah. Okay. I'm sure we can get that. Oh, yeah, thank you. That's actually reminded me of one point I should have covered, is that in terms of language, so we are working with our comms team to get translation into a certain number of languages, which we've had feedback from community partners would be good for East Locality. So we're hoping for the poster and also for the patient safety leaflet and registration forms that will be translated into different languages. So we can definitely send out that and some posters.
Thank you.
Thank you. Any other questions at all? Rajiv?
Yeah, hi Teresa, thanks. And that's really helpful, and I'm glad to see that the DXCT pathway is still happening, because that's very important. If some abnormality is picked up, it goes directly through DXCT pathway. So that's going to be very reassuring for all the GPs. That's one. And the other question I just wanted to check with you, Teresa, was that, if the patients had any sort of imaging, chest imaging in the last 3 months, they're excluded. Is that something that they sort of sign off saying that they've not had any imaging in the last 3 months? Or is there a mechanism that the radiographers are able to check? Because sometimes the interpretation can be slightly different.
Sure. My understanding is that the radiographers will be able to check the whole of UHB, so, QE, Heartlands, Good Hope. I don't know if they'll have access to further afield. So if there's any other places, then they'd have to rely on the patient's information. But yes, they will be doing a check as well to see that they don't have anything on their systems.
And just one other thing, for ladies having this self-referral chest X-ray, is there a sort of a requirement to fill out LMP and things like that? Because obviously, any lady who's having a chest X-ray will need to have a self-declaration that they're not pregnant.
Yes, I'd need to check that with the radiographer. I would presume that would be something they would be checking. It's not specifically on the registration form that the patient ticks. But yes, I think that I'll check that today at our meeting, but I would hope that would be something they would be asking.
Thank you, Teresa.
Thank you. Lovely. We did set aside an hour, but I knew it wouldn't take that long because it just wanted to give the information. In terms of people who are on the call from any East practices, if you are able to, I'd be very grateful if you can share this, especially with GPs. We'll need to know, because if they suddenly receive reports and they're getting confused as to where the x-rays are coming from, it would be extremely useful if GPs could share this, disseminate it within practices. And if anyone knows that they want other practices or GPs would need any further sessions, because it is already into the summer, so I appreciate it's maybe not the best time to have a session like this. Please let people know to reach out to myself, and I'm more than happy to go to individual PCM meetings or other places to present to GPs. In terms of the slides, we have everyone's registration, so we'll send out the slides to yourself, and the meeting has been recorded, so there will be an option also for that recording to be circulated. I'm not sure if Laura's typing something. Thank you. Yes, that would be extremely useful. Yeah, please do feel free to share the slides with any East Birmingham GPs that you know or work with. One other point just to mention, if if you know other GPs further afield in BSol, so we're not advertising it actively in other parts of BSol at the moment, but if there is a patient registered with a GP, say in South or in Solihull or North, and they decide that they hear about the service and they turn up, they can have a chest X-ray at Washwood Heath. So it will be open to all BSol patients, even though we're actively promoting it in the beginning just in East Locality. Great. Thank you so much, everyone, for your time. We'll ensure we share the slides, and please do circulate with all GPs. We'd be very grateful. Thank you.